If you're over 60 and noticing your memory slipping, it might not be normal aging at all. It could be the pills sitting in your medicine cabinet right now. You've probably seen videos promising one secret spoonful to clear your body of medications. Today, I'm revealing why that's a dangerous myth, and the 6 real medication patterns you actually need to watch out for. Millions of us take these medications every day for blood pressure, allergies, sleep, heartburn, anxiety. They help with the problem they were made for. But for the aging brain, some of them come with a hidden cost, one that rarely gets explained at the pharmacy counter. Here's what I want you to understand before we go further. This video is not telling you to stop any medication. Please don't do that on your own. Some of these are genuinely dangerous to stop suddenly. What this video is going to do is help you understand a connection your doctor may not have had time to fully explain, so you can ask sharper questions and protect your brain for the long run ahead. And if you're watching this on behalf of a parent or a spouse, you're not alone. This exact conversation happens in doctors' offices every single day, and most people don't know the right questions to ask. To understand why some medications hit older brains harder, we need to talk about something simple: blood flow, and how it quietly changes as we move past our 60th birthday without any warning. As we move into our 60s, 70s, and beyond, blood vessels naturally get a little stiffer, a little narrower. That means less blood and less oxygen reaching the brain than when we were younger. The brain uses about 20% of the body's oxygen supply, even though it's only about 2% of our body weight. It also needs a steady supply of glucose to function, and that too depends on healthy blood flow. Here's the part that connects everything. When circulation slows down, how efficiently your kidneys and liver clear medications out of your system, day after day, year after year. A dose that was perfectly safe at 50, not because the prescription changed, because your circulation quietly did instead. And that's the bridge we're going to walk across together today. There's one more reason blood flow matters when we talk about dementia specifically. Not all memory loss traces back to the same cause. Some of it is what doctors actually call vascular in origin instead, driven less by a single disease and more by the cumulative effect of reduced blood flow to brain tissue over years. It's one of the few types of decline where daily circulation genuinely makes a real difference. So let's talk about the medications researchers have been watching closely, the ones that come up again and again in long-term studies of older adults, and what that research actually says about them. Stay with me. I want to be careful here, because headlines love to turn associated with into causes. What I'm sharing comes from real research, but it describes risk that builds up over months or years of steady use, not something that happens overnight from a single dose. The goal here isn't panic. It's simple awareness, the kind that helps you ask better questions at your very next doctor's appointment. The first category is anticholinergic medications. That includes many older allergy pills, nighttime sleep aids, some overactive bladder medications, and a few older antidepressants. Large studies following people for years have linked heavy, long-term use of these drugs to a higher rate of cognitive decline later in life. These medications work partly by blocking a chemical messenger the brain relies on for memory and alertness. Blocking it once, occasionally, isn't the concern. Blocking it nightly for years is what researchers are watching. If you're reaching for an allergy pill every single night just to fall asleep, that's exactly the pattern worth mentioning to your doctor at your very next visit, even if it feels small or unimportant. The second category is benzodiazepines, medications often prescribed for anxiety or sleep. Researchers have studied a possible link between long-term use and cognitive decline. It's genuinely debated, partly because anxiety and sleep trouble can themselves be early signs of change in the brain, still worth raising if you've been on the same prescription for years. The third category is long-term high-dose acid reflux medication, proton pump inhibitors. Earlier studies raised concern here. Larger, more recent research has been mixed. Still, if you've taken the same heartburn medication for years, ask whether you still need the same dose. The fourth group is opioid pain medications. These are well known to cause confusion and drowsiness in older adults, especially combined with other prescriptions, which is extremely common after a hospital stay. And the fifth factor isn't a single drug at all. It's simply taking 5, 6, 7, or more medications together. Doctors call this polypharmacy. On its own, it raises the risk of side effects that can look exactly like memory loss, confusion, brain fog, and slower thinking that gets quietly mistaken for something else entirely. There's a sixth pattern worth knowing too. High-dose steroid medications, often prescribed short-term for inflammation or a flare-up, can cause temporary confusion or mood changes in older adults. Usually it fades once the course ends, but it's still worth flagging to your doctor if it happens to you or someone you love. One quick note, because it comes up a lot. Cholesterol medications, called statins, were once suspected of harming memory. The newer, larger research has actually been reassuring for most people who take them. Before we move on, let's clear something up. You've probably seen videos promising one secret trick with a mystery ingredient in your water that instantly clears medication out of your body completely overnight. I want to be honest with you. Real protection for your brain doesn't come from one dramatic spoonful. It comes from daily habits, repeated patiently for years. Real protection for your brain doesn't come from one dramatic spoonful. It comes from daily habits, repeated for months and years. Now, here's the piece that almost never gets mentioned in this entire conversation. Plain water, and the surprisingly direct way it connects to both your circulation and the medications you take. Here's why it matters so much more after 60. As we age, our sense of thirst gets weaker, so we can already be mildly dehydrated before we ever feel thirsty. And many seniors deliberately drink less water, worried about frequent bathroom trips. But dehydration doesn't just make you tired, it slightly thickens the blood, reduces blood volume, and can lower blood pressure. Think of thick, sluggish syrup moving through a straw instead of water moving freely, all of which reduce blood flow to the brain even further. And your kidneys need adequate fluid to clear medications properly. When you're dehydrated, those medications can linger longer than intended, raising the exact risk we've been discussing. Picture someone you might recognize, a 78-year-old woman managing a sleep aid, a bladder medication, and a heartburn prescription. Quietly, every single day, she drinks maybe 2 small glasses of water a day because she doesn't want to be up all night. Her family starts noticing she seems foggier by evening and quietly assumes it's just part of getting older. But it could just as easily be 3 medications lingering longer than they should in a body that's quietly running low on fluid. That's not a scare story, it's a completely ordinary, fixable situation. Let's make this practical, because understanding the problem only really helps if you know exactly what to do differently starting tomorrow morning with your very first glass of water of the day. First, spread your water intake across the whole day instead of a few big glasses. Small, steady sips are easier on the bladder and keep your blood volume more stable. Second, if you sweat easily or you're on a diuretic blood pressure medication, ask your doctor whether a small amount of added electrolytes makes sense for your specific situation and daily routine. Sodium, potassium, and magnesium help pull water into your cells, not just through them. Third, and this one gets overlooked constantly, a short walk after meals, even 5 or 10 minutes, genuinely improves circulation. It's one of the simplest, most researched ways to support blood flow to the brain. Movement and hydration work together. One supports the other. Fourth, use a simple gauge instead of guessing. Pale yellow generally means you're well hydrated. Dark yellow is your body's clear signal to drink more, and sooner rather than later in the day. And fifth, the single most powerful thing you can do. Ask your doctor or pharmacist for a medication review, sometimes called a brown bag review, going through every single bottle together, carefully. This is often when people discover they're still taking something from 3 years ago that nobody ever revisited, quietly sitting in the cabinet, doing more harm than good the whole time. One more thing before we close, because I know this is the real fear underneath all of this. Occasionally forgetting a name or misplacing your keys. That's ordinary aging, and it happens to nearly everyone. What's worth mentioning to a doctor is a real change from your own personal baseline. Getting lost on a familiar drive you've taken hundreds of times. Repeating the same question within minutes of asking it. A family member gently telling you something feels different lately, especially if that change lined up with a new medication or a recent dose increase, even one that seemed small at the time. You know your own mind better than anyone else does. Trust that. And don't be afraid to say it out loud. 5 simple habits. None of them require a secret ingredient. All of them are backed by how your body actually works. Here's what I want you to walk away with. Your brain deserves the same attention you give your heart or your blood pressure. That means understanding how medications and circulation work always. If this helped you see the connection more clearly, share it with someone whose medicine cabinet you worry about. A parent, a spouse, a friend who's been on the same prescriptions for years now. Write these questions down before your very next appointment. It's the single easiest way to make sure this conversation actually happens, instead of getting lost in a rushed 15-minute visit. And if you want more videos like this, honest, no gimmicks, just what the research actually says, subscribe, and I'll see you in the next one with more real answers and far fewer empty promises. Take care of that brain of yours. It's the only one you've got. And so are the people who love you, who are counting on you to ask the right questions, starting today, not someday.